One. Please start, sir. We are live.
Good evening, all the audiences. Good evening, Aashirwad, sir.
Good
My
evening.
name is Rajesh, and I'm Digital Manager here. On behalf of Zydus Healthcare, I'm happy to welcome all of you for this novel initiative called as TimesTalk. Basically, the TimesTalk is a novel agent. TimesTalk is a program on Imeglimin, which is a novel agent in T2D armamentarium. To discuss upon this topic, we have eminent speaker from Mumbai, Dr. Aashirwad Pawar, and sir will going to discuss about Imeglimin, which is a novel agent in T2DM management. Just to give you a brief of Aashirwad, sir. Sir is an IDF certified diabetologist with an experience in the management of diabetes in IPD and OPD patients. Sir has an experience in pre and post operative diabetes management and critical patients as well. When it comes to education, sir has completed his MBBS from Bharati Vidyapeeth University, Pune. Sir has a practice at Sai Aashirwad Hospital, Mira Road. Uh, he has also practiced at Anand Orthopedic Bone and Joint Care Center, Dahisar East. Sir has a multiple certification course like PG course in advanced diabetes from Harvard Medical School, UK practice of advanced healthcare communication from University of Buckingham held in campus at Crete, UK. So see, he has a multiple certification course plus various workshop. Sir is member of IPA, RSSDI, HPI, and IMA. So from here, I hand over the program to Dr. Aashirwad sir. Meanwhile, I request audience if they have any question, they can post their question in chat box, and the sir will going to address all the question at the end of the session. From here, I invite Dr. Aashirwad sir. Over to you, sir.
Thank you so
Thank you.
much. So let's just start. This is going to be a long session. So first of all, welcome to this virtual CME session of Imeglimin. Today we are diving into an exciting addition to the arsenal against type 2 diabetes mellitus. Imeglimin, a novel agent, offers promising avenues for managing this prevalent condition. Join us as we explore its mechanisms, clinical efficacy, and potential implications in diabetes care. Let's embark on this journey together to enhance our understanding and clinical practice in tackling type 2 diabetes mellitus with Imeglimin. So Imeglimin, is this the need of the hour? This is the first in a group of oral tetrahydrotriazine compounds. This medication works in two ways to help with diabetes. First, it helps the body release more insulin when blood sugar level rise. Second, it helps the body use insulin more effectively, making it easier for cells to absorb sugar from the bloodstream. So Imeglimin is this new kind of medicine that's been given the green light for treating type 2 diabetes, and it works in a unique way compared to other drugs. Japan was the first to say yes to this medication back in June 2021, and it's also been approved by the DCGI. Scientists have done a lot of research on it, both in labs and with real patients, and it's shown a promising results. One big study called the Phase 3 TIMES program is being run by Poxel and Sumitomo Dynapon Pharma. What makes Imeglimin special is that it's a pill that does two things. It helps your body release more insulin when your blood sugar is high, and it also helps your body use insulin better when it's readily available. So let's break down this slide to explain the mechanism of action of Imeglimin in a simple and clear manner. So Imeglimin works by enhancing the function of beta cells in the pancreas, which are responsible for insulin secretion. First, the glucose entry and metabolism. Glucose enters the beta cell through the GLUT2 transporter. Inside the cell, glucose is phosphorylated by glucokinase to form glucose 6-phosphate. This glucose 6-phosphate is then metabolized to pyruvate, which enters mitochondria. Second, role of mitochondria. Within the mitochondria, pyruvate undergoes further metabolism, leading to an increase in the ATP-ADP ratio. This increase in ATP-ADP ratio is crucial as it affects the potassium ATP channels. Next, membrane depolarization and calcium influx. The increased ADP-ATP ratio causes the potassium ATP channels to close. Closure of these channels leads to membrane depolarization. Membrane depolarization opens voltage-gated calcium channels, allowing calcium to enter the cell. Next comes the insulin secretion. The influx of calcium into the beta cell triggers the release of insulin from storage granules. Now, imeglibin specific action. Imeglibin influences the NAD plus salvage pathway, which is crucial for maintaining cellular NAD plus levels. It enhances the activity of NAMPT, which converts nicotinamide to NMN. NMN is then converted to NAD plus by NMNAT. These increased NAD plus levels lead to the activation of CD38. CD38 produces two important signaling molecules, NAADP and CADPR from NAD plus. Now NADP and CADPR further mobilize calcium from intracellular stores such as the endoplasmic reticulum and lysosomes through TPC, that is the two-pore channels and ryanodine receptors. This mobilization of intracellular calcium amplifies the calcium signal. The amplified calcium signal further enhances insulin secretion from the beta cells. I know this is a lot to digest in one go, so let me go through this pathway again in an extremely simple language just to get the things right. First, sugar from the food enters the cell through the special doorway. Inside the cell, sugar is broken down into simpler form, which then goes into a small energy factory, that is the mitochondria. This process increases the cell's energy level, that is the ATP. The increased energy closes another doorway for potassium. When this doorway closes, it changes the cell's electrical charge. The change in electrical charge opens a doorway for calcium to enter the cell. Now, calcium is very important for the next step, that is release of insulin. Imeglibin helps increase the potassium production of molecule called NAD+, which is important for energy production. More NAD+ leads to better energy production and more calcium being released inside the cell. The extra calcium from inside the cell also helps to release even more insulin. In summary, imeglimin helps the cell make more energy and use calcium better. This leads to more insulin being released, which helps lower blood sugar levels. This slide provides an overview of how imeglimin works at the cellular level to improve beta cell function and enhance insulin action in the body. Mitochondrial effects. The partial inhibition of complex 1. Imeglibin partially inhibits complex 1 in the mitochondrial respiratory chain. This action reduces the production of active oxygen species, that is the ROS, which are harmful to the cells. By reducing ROS, imeglibin lessens oxidative stress, protecting the cells from damage. It helps restore the function of complex 3, another component of the mitochondrial respiratory chain. It also prevents the opening of the mitochondrial permeability transition pore, that is the MPTP, which is crucial in preventing cell death. These actions collectively lead to increased ATP generation within the beta cells, enhancing their energy supply. The other cellular metabolic pathways are increase in the NAMPT and NAD+. It increases the activity of NAMPT, that is nicotinamide phosphorobenzol transferase, an enzyme involved in the NAD plus salvage pathway. This results in higher levels of NAD plus, that is nicotinamide adenine dinucleotide, a vital molecule for cellular metabolism. Increase in the calcium mobilization. The increase in NAD plus enhances the calcium mobilization within the cells, which is essential for various cellular functions, including insulin secretion. Now, what are the functional outcomes? First, it improves the beta cell function and production, increases glucose-dependent insulin secretion, that is enhanced ATP generation and calcium mobilization lead to improved insulin release in response to glucose, prevents beta cell death by reducing oxidative stress and preventing MPTP opening. Imeglimin protects beta cells from apoptosis. Now, increase functional beta cell mass. Overall, these protective effects help maintain a healthy population of beta cells. Another function outcome is enhances the insulin action in liver. It reduces the excessive gluconeogenesis. Imeglimin helps lower the production of glucose from non-carbohydrate sources in the liver. It also reduces fat accumulation in the liver, which is beneficial for the metabolic health. In muscles, it increases insulin signaling. Imeglimin enhances the cell's response to insulin, improving glucose uptake. It stimulates the glucose uptake, leads to better glucose utilization by muscle cells, aiding in blood sugar control. Again, let's summarize all this in extremely simple manner. This slide shows how improving mitochondrial function and cellular processes can help with diabetes by supporting insulin producing cells, that is the beta cells, and enhancing insulin action in the liver and muscles. Mitochondrial benefits, that is the ROS, the decrease in production of damaging molecules protecting cells, improved energy production, boost energy generation in insulin producing cells, protection from the cell death, prevents mechanisms that lead to cell death, keeping cells healthy. Cellular metabolic pathways, increased key enzymes and molecules. It raises levels of important enzymes and molecules which are crucial for energy and cell death. Enhances calcium movement in cells, essential for insulin release. In short, enhancing mitochondrial function and cellular pathway supports insulin producing cells and improves insulin secretion, which is beneficial for managing diabetes. Now let's discuss the pharmacokinetics and pharmacodynamics of imeglimin. These points highlight imeglimin safety, efficacy, and ease of use in managing diabetes across different populations. The dose is 1000 mg twice daily. Low protein binding, that is 1 to 8%. Imeglimin does not attach much to proteins in the blood. This means most of the drug remains free and active in the bloodstream. Now, why this matters? This can influence how the drug works and how it is distributed in the body. Second is urinary excretion. Imeglimin is mostly removed from the body through urine without being. This matters because it shows how well your kidney works. That is measured by creatinine clearance, will affect how quickly imeglimin is cleared from your body. No drug-to-drug interactions. Imeglimin does not interfere with the action of metformin, sitagliptin, or cimetinide, which are other common medications for diabetes. This means that it can be safely taken with these medications without worrying about adverse interactions. No QT or QTC prolongation. Imeglimin does not affect the heart's electrical activity. This ensures that the drug does not pose a risk of heart rhythm problems, making it safer for the patients. This drug works the same way in both Caucasians and Japanese patients. This means dosing and effectiveness are consistent across these populations, simplifying its use globally. Now, key points about imeglimin use in special populations. Renal dysfunction. Moderate to severe kidney issues. No clinical trials have tested imeglimin in patients with moderate to severe kidney problems. That is, eGFR is less than 45. Therefore, it is not recommended for these patients. Indian regulation. Indian health authorities advise against using imeglimin in any dose for type 2 diabetes patients with chronic kidney disease, that is CKD stage 3B or worse. That is again less than eGFR less than 45. Liver dysfunction, moderate liver issues. Imeglimin is safe and well tolerated in patients with moderate liver impairment. Severe liver issues, no clinical trials have been conducted in patients with severe liver dysfunction, so it's not recommended for these patients. Lactation. Breastfeeding consideration. The decision to continue or discontinue breastfeeding while on imeglimin should balance the benefits of the drug and breastfeeding. Animal studies have shown that imeglimin can transfer to milk. Imeglimin should not be used during pregnancy. Now let's see some clinical trial experiences. This is an 18-week phase 2 efficacy trial. That is, dual mechanism is observed. This study shows the result of a study that lasted for 18 weeks and included 59 participants. The study looked at how well imeglimin works compared to placebo. We come to the left chart. This chart shows how much more insulin the body produced when imeglimin compared to the placebo. The red bar represents imeglimin, the gray bar is placebo. Imeglimin led to a significant increase in insulin production, that is 2.57 units, compared to placebo that was 0.69 units. The p-value, that is 0.025, indicates that this result is statistically significant, meaning it is likely not due to chance. The right chart. This chart shows how well the body responded to insulin with imeglimin compared to the placebo. Again, the red bar is imeglimin, the gray is placebo. Imeglimin significantly improved the body response to insulin, that is 0.0188 units, compared to placebo, that was 0.006 units. Here, the p-value is 0.001, indicates it is a very strong statistical significance, reinforcing that this result is reliable. To summarize, imeglimin greatly increases insulin production. It significantly improves the body's response to insulin. The results show that imeglimin effectively targets two main problems in type 2 diabetes, that is low insulin production and poor response to insulin. Now, this study is imeglimin increases glucose-dependent insulin secretion and improves beta cell function in patients with type 2 diabetes. The goal of the study was to see how well imeglimin helps the body release insulin in response to glucose. The study design, the study was conducted with 33 patients who have type 2 diabetes. It was double-blind randomized placebo-controlled study. This means neither the patients nor the researchers knew who was receiving imeglimin or placebo until the study was completed. Patients were randomly assigned to receive either imeglimin or the placebo to eliminate the bias. The results were as follows: insulin response to glucose. After 7 days of treatment, patients who took imeglimin showed a 112% increase in their insulin response to glucose. First phase insulin secretion. The initial burst of insulin release was increased by 110%. The second phase insulin secretion, the sustained release of insulin was increased by 29%. Beta cell function. Imeglimin improved how well the beta cells respond to glucose by 36%. It also tended to decrease the amount of insulin removed by the liver by 13%. Imeglimin did not affect the secretion of glucagon, another hormone involved in the blood sugar regulation. To summarize, imeglimin significantly boosts the insulin response to glucose, improves the function of insulin producing cells, and slightly reduces insulin breakdown by the liver. These effects help better control blood sugar levels in patients with type 2 diabetes without affecting other hormones like glucagon. This study is the efficacy and safety of imeglimin in Japanese patients with type 2 diabetes study overview. This was a 24-week clinical trial designed to evaluate the effectiveness and safety of imeglimin for treating type 2 diabetes in Japanese patients. The trial was randomized, double-blind, and placebo-controlled. The goal was to determine how well imeglimin works and how safe it is when used alone, that is without any other diabetes medication over 24 weeks. Patients with type 2 diabetes were randomly divided into 4 groups. One group received placebo. The other 3 groups received different doses of imeglimin, that is 500 milligrams, 1000 milligrams, or 1500 milligrams taken twice a day. The treatment lasted for 24 weeks. The main result measured was the change in HbA1c levels after 24 weeks compared to placebo. This study helps determine the best dose of imeglimin and confirms its effectiveness and safety for managing type 2 diabetes in Japanese patients. Conclusion of the study: because 1500 mg dose was not significantly more effective than the 1000 milligram dose and could cause more side effects, the researchers decided that 1000 mg twice a day is the best dose to use in future studies. Times 1 trial overview. Now, what is Times 1? Times 1 stands for the trials of imeglimin for efficacy and safety. It is a clinical study to test how well and how safely imeglimin works. This was a carefully controlled study where neither the patients nor the researchers knew who was receiving the actual drug, that is imeglimin, and who was receiving placebo. This is the randomized and double blind to ensure unbiased results. The trial involved 213 patients from Japan who have diabetes. Patients were given either 1000 mg of imeglimin twice a day or a placebo for a total duration of 24 weeks. The main goal was to see if imeglimin could significantly lower HbA1c levels. HbA1c is a measure of average blood sugar levels over the past 2 to 3 months. Imeglimin met this goal very successfully. Patients taking imeglimin had their HbA1c levels drop by an average of 0.87%, more than those taking placebo. This result was highly significant with a p-value of less than 0.0001, meaning it's very unlikely to have happened by chance. Secondary endpoint. The study also looked at other measures like fasting plasma glucose. The outcome, imeglimin showed significant improvements in these measures as well. To summarize, the TimesTalk trial demonstrated that taking 1000 mg of imeglimin twice a day for 24 weeks effectively lowers blood sugar levels in patients with diabetes. The results were strong and reliable, showing significant improvements in HbA1c and other blood sugar measures compared to the placebo. Now comes the times 2, that is trials of imeglimin for efficacy and safety. The study was designed to evaluate how well imeglimin works and how safe it is over a long period. The study lasted for 52 weeks, that is 1 year. It was an open label trial, meaning both the doctors and the patients knew they were receiving imeglimin. 714 Japanese patients were with type 2 diabetes participated. The patients were divided into parallel groups, meaning different groups were studied at the same time. Each patient took 1000 mg of imeglimin twice daily. Imeglimin was given along with diabetes medications they were already taking. The results were as follows. HbA1c reduction. The main measure of success was the reduction in HbA1c. Imeglimin led to a decrease of HbA1c levels from 0.56% to 0.92% from the starting point. Long-term safety and efficacy. Over the course of a year, imeglimin was found to be both effective and safe for the patients. HbA1c improvement. A significant reduction in HbA1c indicates better sugar control. Imeglimin, when taken twice daily along with other diabetes medication, helps improve long-term blood sugar levels in patients with type 2 diabetes. The study supports the use of imeglimin as a beneficial addition to existing diabetes medications. Now comes the phase 3 times 2 study results. This explanation focuses on the phase 3 times 2 study of imeglimin, particularly looking at changes in HbA1c levels over 52 weeks with a total of 714 participants. Again, the duration was for 52 weeks, that is 1 year. HbA1c change from baseline at 52 weeks. The difference in HbA1c levels from the start to end from in the 52-week period. Add-on therapy, imeglimin added to the diabetes medications, and monotherapy, imeglimin used alone without any other diabetes medications. The results with add-on therapy were with DPP-4 inhibitors. When imeglimin was added to other medications, especially with DPP-4 inhibitors, there were significant improvements. The combination therapy led to a notable reduction in HbA1c levels, indicating better sugar control. Compared to monotherapy, even when used by itself, imeglimin effectively lowered HbA1c levels. The results showed strong benefits in managing blood sugar levels without needing additional medications. In summary, imeglimin works very well when used with other diabetic drugs, particularly DPP-4 inhibitors. This combination enhances blood sugar control. Imeglimin is also effective on its own, providing a strong option for patients who may not be taking other diabetes medications. Now comes the TimesTalk trial overview. The TimesTalk trial aimed to assess the effectiveness and safety of a new treatment, that is imeglimin, for patients with type 2 diabetes who were already on insulin but still had trouble controlling the blood sugar levels. It was a 16-week double-blind phase. Here, 215 patients participated. They were randomly divided into two groups. One received imeglimin and other received placebo. Neither the patients nor the doctors knew who were receiving imeglimin and who was receiving placebo, that is double blind. The goal was to compare how well imeglimin works in lowering blood sugar level versus the placebo, and to check if there are any safety concerns with imeglimin when used alongside insulin. The 36-week open label extension period. What happened here was 208 patients who finished the first 16 weeks continued into this phase. In this phase, all patients received imeglimin in addition to their insulin therapy, that is no placebo group. Both the patients and doctors knew that imeglimin was being administered. This is the open label. To further observe the effectiveness and safety of long-term use of imeglimin with insulin was the goal. To summarize, the first 16 weeks, testing the initial effectiveness and safety of imeglimin compared to placebo in a controlled blinded setup. And the next 36 weeks, observing the long-term effects and safety of imeglimin when all patients are on treatment, providing a comprehensive view on its impact over nearly a year. The conclusion of the study, the sustained improvement with imeglimin, long-term effectiveness, patients were given imeglimin for an extended period, that is 52 weeks or a year. On average, there was a sustained decrease in HbA1c levels by 0.64%. Combined treatment with insulin, some patients received both imeglimin and insulin, but only during the last 36 weeks of the 52 week. The results, these patients showed an average HbA1c decrease of 0.54%. This suggests that adding imeglimin to insulin therapy also helps improve blood sugar control, although the improvement was slightly less compared to using imeglimin alone. This table presents data from a study called TIMES, that is Trials of Imeglimin for Efficacy and Safety. This study looked at how well a drug, that is imeglimin, reduces HbA1c levels in patients with different stages of chronic kidney disease. The key points here are TIMES 1 showed consistent reduction in HbA1c across all CKD stages, with the highest reduction in stage 2, that is 0.82%. TIMES 2 reported a range of HbA1c reduction indicating variability, especially in stage 1, that is 0.23% to 0.95%, and stage 2, that is 0.02% to 0.95%. TIMES 3 showed good reduction in HbA1c for stage 1, that is 0.72%, and stage 2, that is 0.64%, but did not provide data for stage 3. This means imeglimin can help reduce blood sugar levels in patients with CKD, but the extent of its effectiveness can vary depending on the stage of kidney disease and the study. The study, the effects of imeglimin on the daily glycemic profile evaluated by intermittently scanned glucose monitoring, retrospective single center observational study. The goal of the study was to see how well imeglimin works in controlling blood sugar levels when measured by continuous glucose monitoring method. The study design and participants, the researchers looked at 32 patients who were already taking some form of treatment for their diabetes. They added imeglimin to their existing treatment. Then they monitored these patients for more than 4 weeks. To help you understand the results of this study, let's go through the key findings in straightforward manner. This study looked at the effects of a drug imeglimin on blood sugar control by using a method called intermittently scanned continuous glucose monitoring, that is ISCGM. The study compared various blood sugar metrics before and after participants took imeglimin. Here's a simple breakdown of the table. The key metrics explained are the mean glucose, coefficient of variation, that is variability in blood sugar levels, the mean of daily difference, that is this measures day-to-day variability in blood sugar, time in range, that is this is the percentage of time blood sugar levels are within the time range, that is target range, that is the 70 to 160. Time below range, above range, sorry, time above range, the percentage of time blood sugar levels are above the target range, and TBR, that is time below range, that is blood sugar levels below the target range. So let's see the results overview. Mean glucose before imeglimin was 161 and after was 141. P value is less than 0.001. So the average blood sugar level significantly decreased after imeglimin. Mean glucose before imeglimin was 8.94 and after imeglimin was 7.83. P value is less than 0.001 again. The average blood sugar level in millimole per liter also significantly decreased after taking imeglimin. The coefficient of variation, that is CV, before imeglimin was 28.5, after was 26.7, p-value 0.058. The variability in blood sugar level slightly decreased, but this change was not statistically significant. Mean of daily difference, that is your MODD, before was 37.8, after was 28.9, p-value 0.197. The day-to-day variability in blood sugar levels decreased, but this change was not statistically significant. Time in range before imeglimin was 69.5% and after was 82%. P-value less than 0.001. This percentage of time blood sugar levels were within the target range significantly increased after taking imeglimin. Time above range, that is the TAR, before was 28.5%, after 17%. P-value less than 0.001. The percentage of time blood sugar levels were above the target range significantly decreased after taking imeglimin. TBR, that is time below range, before imeglimin was 0%, after was 0% as well. P-value 0.194. The percentage of time blood sugar levels were below the target range remained unchanged. Now the highlighted findings over here: significant improvement in mean glucose levels. There was a significant reduction in average blood sugar levels after taking imeglimin. Participants spent significantly more time with their blood sugar levels within the target range. Participants had significantly less time with high blood sugar levels. In summary, imeglimin effectively improved overall blood sugar control by lowering average blood glucose levels and increasing the time blood sugar levels stayed within the target range, which are critical goals in diabetes management. Now imagine a daily glucose profile like a roller coaster ride, showing how your blood sugar levels go up and down throughout the day. Now imeglimin is like a controller for that roller coaster, helping to keep it in a good range. In a study with Japanese patients who have type 2 diabetes, imeglimin made this roller coaster ride smoother, which means it helped keep their blood sugar levels in a healthier range throughout the day. So it seems that imeglimin can help improve how well these patients can control their blood sugar levels in the short term. Now this is the phase 3 clinical trial report. This study aimed to see if imeglimin tablets are effective, safe, and tolerable for patients with type 2 diabetes who aren't well controlled by diet and exercise alone. It was done at multiple places with participants randomly assigned to different treatment groups, some getting imeglimin tablets and some getting placebo, and neither the participants nor the researchers knew who got what. This helps ensure the results are unbiased. They are compared to the outcomes between the groups to see if the imeglimin tablets work better than doing nothing or using other treatments. This slide presents the results of a study comparing the effectiveness of imeglimin hydrochloride tablets of 1000 mg to placebo tablets in reducing HbA1c levels over a period of 16 weeks. Key points from the slide: change in HbA1c levels. Patients taking imeglimin experience a significant reduction in their HbA1c levels with a mean change of 0.73%. In contrast, patients on the placebo had a slight increase in HbA1c levels with a mean change of 0.13%. Difference between the groups. The difference in the mean change between the imeglimin group and the placebo group is 0.86%. This difference is statistically significant with the p-value of less than 0.0001, indicating that risk reduction in HbA1c due to imeglimin is not due to chance. Visual representation. The bar graph on the right visually illustrates these changes. The blue bar shows the mean reduction of 0.73% for the imeglimin group, while the orange bar shows the mean increase of 0.13% for the placebo group. The 95% confidence level, that is CI, for the imeglimin group reduction is between 0.77% and 0.69%. The 95% CI for the difference between the imeglimin and placebo groups is between 0.93% and 0.79%. In summary, this slide demonstrates the imeglimin hydrochloride tablet significantly reduced HbA1c level compared to placebo, suggesting its potential effectiveness in managing blood glucose levels in patients. Next slide. Yeah. So this slide shows the results of a study measuring the change in fasting plasma glucose levels from baseline to the end of a 16-week period for patients taking imeglimin hydrochloride, again 1000 mg, compared to those taking placebo tablets. The key points here are change in fasting plasma glucose FPG levels. Patients taking imeglimin saw a significant reduction in their FPG levels with a mean change of minus 13.06 milligram per deciliter. Patients on the placebo experienced an increase in FPG levels with a mean change of plus 7.97 milligram per deciliter. The difference in the mean change between the imeglimin group and the placebo group is minus 21.03. This difference is statistically significant with a p-value of less than 0.0001, indicating that the reduction in FPG due to imeglimin is not due to chance. The bar graph on the right side of the slide visually represents these changes. The blue bar shows the mean reduction of minus 13.06 for the imeglimin group, while the orange bar shows the mean increase uh, of plus 7.97. Confidence levels, the 95% confidence interval for the imeglimin group's reduction is between minus 14.03 and minus 12.09. The 95% of CI for the difference between the imeglimin and placebo groups is between minus 22.76 and minus 19.30. In summary, this slide demonstrates that imeglimin significantly reduces fasting plasma glucose levels compared to placebo, suggesting its potential effectiveness in managing blood sugar levels in patients. Now, this slide shows results of a study measuring the change in 2-hour postprandial glucose levels from baseline to the end of a 16-week period for patients taking imeglimin compared to those taking placebo. Key points: patients taking imeglimin experience a significant reduction in the 2-hour PPG levels with a mean change of minus 21.10. Patients on the placebo saw an increase in 2-hour PPG levels with a mean change of plus 12.75. The difference in the mean change between the imeglimin group and the placebo group is minus 33.85. This difference is statistically significant with a p-value of less than 0.001. Now, the bar graph on the right side of the slide visually represents these changes. The blue bar shows the mean reduction of minus 21.10 for the imeglimin group, while the orange bar shows the mean increase of plus 12.75 for the placebo group. Confidence intervals: the 95% confidence interval for the imeglimin group's reduction in between minus 22.94 and minus 19.27. The 95% CI for the difference between the imeglimin and placebo groups is between minus 37.18 and minus 30.52. In summary, this slide demonstrates the imeglimin reduces 2-hour postprandial glucose levels compared to placebo, suggesting its potential effectiveness in managing blood sugar levels in patients. This table presents information about the adverse effects grouped by different body system. It compares the frequency of these adverse effects in two groups, that is patient taking imeglimin, that is 1000 mg, and control group. The summary is as follows. Nervous system disorders. Imeglimin group, 4 out of 144 patients, that is 2.78%, experience nervous system disorders. That in control group, 2 out of 72 patients experience these disorders, again 2.78%. Gastrointestinal disorders. Imeglimin group were 14 out of 144 patients, that is 9.82%, had gastrointestinal issues. In control group, 6 out of 72 patients, that is 8.33%, had the same issues. Infections and infestations. Imeglimin group, 4 out of 144 patients, that 2.78% experience infections or infestations. Same percentage, that is 2.78, that is 2 out of 72 patients in the control group experience infections or infestations. Musculoskeletal and connective tissue disorders. Imeglimin group, 2 out of 144 patients, that is 1.39% had these issues. Control group, none. No one experienced musculoskeletal issues. Metabolism and nutrition disorders. In Imeglimin group, 4 out of 144 patients, that is 2.78% experience these disorders. In control group, 8 out of 72, that is 11.11% experience these disorders. General disorders and administration site conditions. Imeglimin group, 1 out of 144 patients, that is 0.69%, had general disorders or issues at the administration site. In control group, there was no such experience, nothing experienced as such. In summary, the table shows how often adverse events occurred in patients taking imeglimin compared to those in control group across different body systems. For example, gastrointestinal disorders were more common in the imeglimin group than in the control group, whereas metabolism and nutrition disorders were more in the control group. In the phase 3 clinical trial report, it was found that imeglimin tablets were better than the placebo tablets. This means that imeglimin showed more positive results in treating patients with type 2 diabetes compared to using a placebo, which is like a dummy pill with no active ingredients. What's even better news is that throughout the study, there were no deaths or cases where patients needed to be hospitalized in both the groups that received treatments. This suggests that both imeglimin and the placebo were safe options. Additionally, the patients who took imeglimin didn't report any significant problems in tolerating the medication. This means that it was well received by the patients and didn't cause them any major discomfort or adverse reactions. Overall, these findings indicate that imeglimin is not only effective in treating type 2 diabetes, but also safe and well tolerated by patients, which is great news for managing this condition. Now let's discuss about imeglimin and metformin. Imeglimin, in clinical trials, that is in living beings, boosts insulin release when glucose levels rise, shows signs of improving how sensitive cells are to insulin at the cellular and organ level, increases insulin release, and when glucose levels go up, shields and preserves beta cells in the pancreas, which are responsible for making insulin, helps muscles take up more glucose. In compared to now in metformin, in clinical trials, it doesn't seem to affect how much insulin is released. It doesn't clearly improve how cells respond to insulin. At the cellular and organ level, doesn't change how much insulin is released and when glucose levels rise. Its effects on beta cell mass, that is the number of beta cells in the pancreas, aren't well understood, may or may not help muscles take up glucose. In short, imeglimin helps insulin work better when the blood sugar is high, protects the cells in the pancreas that make insulin, and assists muscles in using more glucose. On the other hand, metformin doesn't seem to directly affect insulin release or how cells respond to the insulin, and its effects on beta cell mass and muscle glucose uptake are less clear. Here, imeglimin location, it works inside the cell. It competes with or partially blocks a specific part called complex 1 in the mitochondria, which are like the powerhouses of the cell. This doesn't slow down the cell's energy production, doesn't reduce the cell's energy production. I covered up. Boosts the production of a substance called NAD+, which is important for various cellular functions, potentially by increasing another enzyme called NAMPT. Also, it might increase the response of the cell to glucose by raising the levels of calcium inside the cell. Metformin location, it also works inside the cell. It partially blocks a different part of the mitochondria called complex 1, but in a different way than imeglimin. This does slow down the cell's energy production, doesn't seem to affect the levels of calcium inside the cell or boost the production of NAD+. So in simple terms, while both imeglimin and metformin work inside the cell, they target different parts of the mitochondria and have different effects on energy production. Imeglimin doesn't slow down the energy production and may have additional benefits like boosting NAD+ production and increasing the cell's response to glucose, whereas metformin does slow down energy production without these additional effects. Now let's see the effects of imeglimin on the cardiovascular system. Recent research indicates that imeglimin has shown promise in preventing the death of cells that line the inside of blood vessels, called the endothelial cells. It does this by blocking a process called mitochondrial permeability, which is involved in cell death. Importantly, imeglimin achieves this without interfering with the cell's ability to produce energy through respiration. This could be beneficial for patients with type 2 diabetes, as improving the health of these cells may help lower the risk of cardiovascular problems. So this study is about there was no prolongation of QTC observed in a study examining the effects of imeglimin on heart function. The study wanted to understand if imeglimin could affect the time it takes for the heart to recharge between beats, which is important for heart health. Researchers did a thorough study on 55 healthy volunteers. They gave these volunteers different doses of imeglimin, 2,250 milligrams and 6,000 milligrams, a drug called moxifloxacin, which is known to affect the heart function, and a placebo, which has no effect. The volunteers didn't know which they were going to get to keep things fair. Researchers then monitored the volunteers' heart function using Holter ECG for at least 24 hours after taking each dose. So basically, they wanted to see if imeglimin had any bad effects on the heart's electrical system, like making it take longer to recharge between beats. They tested it on healthy people to be safe, and they found that even at higher doses, imeglimin didn't cause any problems with the heart's electrical activity. In conclusion, the study found that even when people were given regular and higher than normal doses of imeglimin, it didn't cause any delays in the heart's electrical activity. The researchers are really confident in this conclusion because they used a test that's good at picking up even small changes in heart's activity. This slide illustrates the mode of action of various anti-diabetic drugs in a straightforward manner by categorizing them based on three key mechanisms: enhancing insulin sensitivity, stimulating beta cell activity in the pancreas, and affecting mitochondrial function. Let's start with metformin first. Insulin sensitivity. It enhances insulin sensitivity, which means it helps the body respond better to insulin. It does not stimulate beta cells in the pancreas. No significant action on mitochondria. Coming to sulfonylureas, these do not affect insulin sensitivity. They stimulate beta cells to release more insulin. Again, no significant action on mitochondria. DPP4 inhibitors or GLP-1 receptor agonists, no effect on insulin sensitivity. These enhance the stimulation of beta cells. No significant action on mitochondria. SGLT2 inhibitors, they do not directly affect insulin sensitivity. No direct stimulation of beta cells. No significant action on mitochondria. Imeglimin, it improves insulin sensitivity. It stimulates beta cells to enhance insulin secretion. It has unique action on mitochondria, which is significant and different from other classes. Thiazolidones, they improve insulin sensitivity. They do not stimulate beta cells. No significant action on mitochondria. In summary, imeglimin is noteworthy as it uniquely acts on all three fronts. It improves insulin sensitivity, it stimulates beta cells, and affects mitochondrial function. This triple action makes it distinct among the anti-diabetic drugs listed. Currently available OADs, that is only focus on one aspect of type 2 diabetes. This means that medicines we have right now for T2DM only target one part of the problem. Imeglimin is different because it has a dual mechanism of action. Unlike other drugs, imeglimin targets three important organs involved in diabetes: the pancreas, the liver, and the muscles. Instead of focusing just on one area, imeglimin helps out in three key parts of the body related to diabetes. Imeglimin helps with muscle glucose uptake, liver glucose production, and prevents beta cell death. It helps muscle take in sugar better, reduces the amount of sugar the liver makes, and protects the cells in the pancreas that make insulin. Imeglimin works well on its own and also when used with other medication. It's effective when used alone, but it's even better when combined with other drugs, especially when taken together with DPP-4 inhibitors. It shows the maximum benefit. Thank you for joining me on this Saturday night for my first ever talk, and that too on this interesting and new molecule. I truly appreciate your patience and attention as we delve into this vast topic together. I hope I was able to explain the molecules and the studies conducted on it clearly. Your presence and engagement mean a lot to me, and I'm grateful for the opportunity to share this information with you.
Thank you so much. Thank you so much. Thank you so much, Abhinav, sir. I think this is one of the best time talk which I have attended. The way you have explained all the points, it is really meaningful to all the audiences. There are certain questions in Times in chat box, sir. Are you able to see that questions?
Yes, just one second. I'll just. Yeah, so there's a question like, is imeglimin can replace metformin or sulfonylurea, or how imeglimin superior than metformin or sulfonylurea? So let's just go to that slide again. This one. Can you see? Can you see the slide?
Yes, the slides are visible. I think this question has been asked after this presentation, after this slide.
Yes, yes, yes. So this was solved over here, I'm guessing.
There is one comparison slide, sir. Imeglimin versus metformin.
Yes, yes. So, so as it is said, like imeglimin can be used individually as well, as per that slide we saw. Compared to metformin, like metformin, it enhances insulin sensitivity, which means that it helps the body respond better to insulin. It does not stimulate beta cells in the pancreas, and no significant action was done on mitochondria. Comparatively, imeglimin, it improves the insulin sensitivity. It also stimulates beta cells to enhance insulin secretion. And it has a unique action on mitochondria, which is significant different from the other classes. Other question?
There are few more questions, sir, in chat box. How imeglimin is safe in CKD patients or hepatic compromised patients?
Yes, sir. We went through that as well. So it is safe in CK, like it is not recommended in AGFR less than 45. Like, let me see what slide was that. I think we can show that slide again. Okay, I just made my notes. I'm just going through that. Slide 8. Can we share the slide again?
Yeah, no problem. Please share, sir.
Yes. Yes, yeah. So in renal dysfunction, it was shown that moderate to severe kidney issues, no clinical trials have been tested. Imeglimin in patients with moderate to severe kidney problems, that is EGFR less than 45. Therefore, it is not recommended for these patients. In Indian regulation, Indian health authorities advise against using imeglimin in any dose for type 2 diabetes patients with chronic kidney disease that is stage 3B or worse, that is less than 45.
Correct. I think there are one more question. I think that is the last question. Can we prescribe Imeglimin as first line treatment? And what should be dose? 500 mg or 1000 mg?
So as we saw the study before, the best results were found when Imeglimin was used 1000 mg BD. So so for now there are no like we said, there are no guidelines. They don't recommend using Imeglimin right in the first line therapy. But if we see the patients are not reacting well as per the treatment, we can add this to the presenting treatment, ongoing treatment, or we can replace it with Imeglimin, but not as first line therapy.
Okay, yeah, thank you so much. I think these are the question in chat box. So
Okay.
thank you so much, Aashirwad sir, on behalf of Zydus Healthcare. I thanks all the audiences for their participation, and I thanks Dr. Aashirwad for sharing his most valuable time and throwing light on this new molecule, Imeglimin. Thank you so much, all of you. Have a nice evening.
Thank you for having me. Thank you.
Thank you, sir. Thank you.